Steve, if you could tell me a little bit about your background.
I have been licensed as a marriage and family therapist. I got licensed back in 1980, and then I went back and got a doctorate in psychology. So I am today licensed both as a marriage and family therapist as well as a licensed clinical psychologist. So I treat and I see individuals, couples, and families dealing with depression, dealing with anxiety, dealing with substance abuse. I do a lot of couple and family therapy as well, and dealing with loss. I've also been an instructor at a local university in the past 33 years, teaching a variety of psychology courses. I recently retired from that, and what I'm doing now is I'm conducting workshops. I do this to community counseling services, to graduate schools, to school districts, so on a variety of different topics. So I'm also working as a mentor for those grad students who are seeking their marriage and family therapist license. So my clinical orientation, there's a variety of different orientations out there and a variety of different techniques that therapists use. When a client first comes to see me, I would say my clinical orientation at that point is pretty humanistic. And what that means is I want to do everything I can to get that client to feel safe, to be able to open up and tell me and go into depth about whatever it is that brings that person to see me. So I do a lot of what's called client-centered therapy. Carl Rogers created this, which is really a lot of listening, a lot of empathy, a lot of support to get that client to feel comfortable and then go into more depth. I also do a lot of what we call cognitive behavioral therapy. So let me just explain that a little bit. The premise in cognitive behavioral therapy is that what causes a person's symptoms, whatever it might be, depression, anxiety, substance abuse, is often generated by the way they think about the things that have happened in their lives. And so a lot of this work focuses on what are the assumptions that an individual comes up with. Let's say they go through a divorce, a relationship ends, they do poorly in school. Well, the idea with cognitive behavioral therapy is it's not the event that causes the problem. It's not failing a class, but it's your interpretation, your assumptions about what that means. So I kind of delve deeper into that and help a client look at alternate explanations. The individuals that tend to be struggling with depression, their interpretation is, this means I'm defective, I'm deficient, and that keeps them stuck in depression. So there are a variety of techniques. I think most therapists use different techniques from different clinical orientations.